Hello, I'm Dr. Naresh Parajuli. I've been a medical practitioner for over 30 years. I'm a fellow of Royal Australian College of General Practitioners.
And I'm Dr. Benjamin Tang. I've been awarded a fellowship from the Royal Australian College of General Practitioners, and I've also undergone further specialist training in the United States in no-scalpel vasectomy. So vasectomy is a form of permanent male contraception. It involves cutting a tube called the vas deferens, which joins the testes to the penis. It's a very effective form of contraception. It's actually over 99.9% effective.
There are basically two different types of vasectomy, the old conventional method and the new, what is called the no-scalpel method. And there are also open-ended and closed techniques. We at Dental Procedures Sydney practice no-scalpel open-ended. In this technique, what happens, we give the local anesthetic, numb the area, make a very tiny hole, and then we take one tube at a time, cut a section of the tube, cauterize or burn the end going from there to the abdomen, which is called the abdominal end. And then once that is done, we bury the cauterized end deeper and cover with the tissue. This is a very special step we do at Dental Procedures Sydney, and it is called fascial interposition. Once this is done, we repeat the other side and seal the hole with glue. There are no stitches given in this technique compared to the old conventional method where two cuts are made on both sides of the scrotal skin, and there will be about 5 to 7 stitches after the procedure. This open-ended no-scalpel technique is much simple and can be completed within 10-15 minutes.
Well, whichever technique's used, vasectomy involves blocking the sperm, or stopping the sperm from coming out of the testes, out of the penis and causing a pregnancy.
Vasectomy is a very straightforward procedure which is completed within 10 to 15 minutes. Pain is minimal with the introduction of no needle device and open-ended technique. There is not much pain. Complications are very rare. Common things that you can expect after vasectomy is a bit of bruising, bit of discomfort, mild degree of swelling, and if you just continue ice and Panadol, that will just eliminate the pain and any other discomfort.
Yeah, so it depends on what type of job you have. If it's office-based job or usually light duties, then most people can return in the first day or two. If it's more heavy duties involving manual labour, a lot of squatting, straining, then we advise at least a week off work. Otherwise, flying, you're fine to fly after the vasectomy, no alcohol for at least 48 hours, and no swimming for at least a week as well.
First of all, it is very important to understand the difference between vasectomy reversal and a successful pregnancy. Vasectomy can be reversed in about 90 to 95% of the cases. However, it doesn't mean that the successful pregnancy is the same. The chance of successful pregnancy is just about 60 to 75% at this stage in Sydney. However, the cost of vasectomy is very high, ranging from $4,000 to $15,000 in Sydney, and it's a complicated procedure, unlike doing a vasectomy.
So vasectomy here at Dental Procedures costs $750 up front. You do get a $215 Medicare rebate from that, and I think you'll find we're one of the most affordable vasectomy places in Sydney, and also we have a very short waiting time, so we can get you in for your vasectomy as soon as you're ready.
Yes, you still come normally after vasectomy. The only thing that's not happening is the sperm is not there in the cum. So if you look at what is composed of cum before vasectomy, it is 97 to 98% is just liquid coming from the prostate and the seminal vesicle. They are the sperm carriers. Only 2 to 3% is sperm. That's what we do by blocking it. So the other question you asked is what happens to the sperm? Because we at Gentle Procedures Sydney practice only open-ended technique, when you have sex, the sperm comes out of the testicles and it is deposited around the testicles. And because there is no way to get out of the penis, it is deposited around the testicle. The sperm die natural death and it is recycled into the body. So, and the other thing is, if you ejaculate, the color, the consistency, the taste, everything is same. There is no difference between pre-vasectomy cum and after vasectomy cum. You can have sexual intercourse after vasectomy as soon as you feel comfortable, which means it is normally 5 to 7 days after the procedure. However, it is very important to understand that you are not sterile straight away after vasectomies, which means you may still make your partner pregnant. So it is important to use other method of contraception until our clinics do a semen test and confirm that it is safe to have sex. That is 3 months and 4 months down the track. We do semen analysis test to confirm that the vasectomy has been successful and that you are not able to make your partner pregnant again. As per Australian standard, we advise doing 2 semen tests. The first one is normally after 3 months from the day of the procedure. The second one is after 4 months.
Vasectomy doesn't really change the way you perform at all. It doesn't have any bearing on your ability to have an erection. But many men feel that without the anxiety of causing an unwanted pregnancy, that they can focus more on the job and less on worrying.
Vasectomy will not change you sexually. Almost everything is the same except that no sperm comes out when you have sex. It doesn't affect the testosterone level because the testes are still intact. They still produce the same amount of testosterone. Your libido will be the same. It doesn't cause erectile dysfunction. It doesn't cause any premature ejaculation. You will be the same like before vasectomy.
So you don't need a referral letter to come and see us to get a vasectomy. You can book directly in with us where you'll have the phone answered by our nurse or by Dr. Parajuli himself. We offer very short waiting time. We can get you in quickly, although if your GP wants to write a referral, that's completely fine as well.
In New South Wales, if somebody is above 18, technically they can get a vasectomy. But most doctors do not do vasectomy if they are too young and if they don't have children. So in our Gentle Procedures clinic, we normally don't do if somebody doesn't have a child or if they are too young, less than say 25 years. We do on a case-by-case basis. However, if they have some medical conditions or they have intellectual or physical disability, we take that into account and do or not do vasectomy accordingly. It's not important to get the partner's consent or permission to do a vasectomy in New South Wales. However, I stress that it is always very important to discuss with the partner because it is a joint decision. It's very important to discuss with the partner before you make a decision to do a vasectomy. It is not necessary to freeze your sperm before vasectomy. However, if you are unsure whether you are thinking of getting children in future, or if you don't have children now but may consider having in future, it's always good to freeze your sperm. It's like insurance for the future. You don't have to worry about that. If you have any questions or queries, please do not hesitate to contact us at Gentle Procedures Sydney Clinics.